If someone is asked to describe their health, they'll usually say that they're diabetic. Most people don't mention whether they have type 1 or type 2 diabetes. Both conditions cause the body to struggle with glucose storage and usage. Glucose is used by the body to create energy, and diabetics have impaired ability to collect the free glucose in the bloodstream, starving the body's cells of needed energy. The two main types of diabetes have many similarities, but they are different diseases. Let's differentiate between them. Diabetes type 2. Type 2 diabetes is the most common, affecting 90 to 95% of Americans with diabetes. It occurs most often in mature individuals over the age of 45, but teenagers, young adults, and children are being affected too. Diabetes type 2 is when your body can still produce insulin, but the insulin produced is much less useful. You actually become resistant to this hormone that the body needs to regulate your blood glucose levels. Risk factors. Ethnicity plays a huge role in the risk of developing type 2 diabetes. According to Harvard Medical School, Asian Americans, African Americans, Native Americans, and Hispanics are much more likely to develop type 2 diabetes. Genetics is another risk factor. Inheriting certain genes makes you 3 times more likely to develop diabetes. The main culprit is the development of lipids inside the pancreatic B cell membranes, which cause blockage of the process of storing and converting glucose to energy. Obesity is another risk factor if you have a body mass index of 25 or greater. Smoking increases your risk of developing type 2 diabetes by 30 to 40%. A lack of exercise and an unhealthy diet also increases your risk. Environmental factors certainly contribute risk. Type 2 diabetes might even be the consequence of having too little vitamin D. And finally, age plays a big role. Type 1 diabetes. Type 1 diabetes only affects around 5% of Americans, and it shares many similarities with type 2 diabetes, but it develops differently. Type 1 diabetes is an autoimmune disorder, meaning that the immune system attacks and destroys the pancreatic beta cells that produce insulin. It's unknown why the immune system attacks the pancreatic cells, but during the process, the pancreas stops making insulin, and supplemental insulin is needed from that time on. Symptoms of type 1 diabetes appear much faster and are much more profound. Although adults can develop type 1 diabetes, and men are more likely to develop it than women, it's most prevalent among children, and it typically sets in at puberty. The rate of increase globally is at 3% annually among children. Risk factors. The risk factors are highly debatable in type 1 diabetes, but it comes down to a few potential culprits. Genetics play a role if a child has beta cell autoantibodies. This affects the way their bodies process glucose because the antibodies automatically destroy insulin or beta cells. According to Stanford Children's Health, being Caucasian increases your risk of developing type 1 diabetes, which is the opposite of type 2 diabetes. Having cystic fibrosis, which causes scarring on the pancreas that stops the organ from producing insulin, also puts you at higher risk. Hemochromatosis, which causes an overload of iron that can damage the beta pancreatic cells, is also a risk factor. Viral childhood infections can also cause type 1 diabetes, such as rubella, measles, and mumps. Many other autoimmune disorders in which the immune system attacks organs such as the pancreas can lead to type 1 diabetes. Examples of these disorders include celiac disease and thyroid autoimmune disease. Type 1 diabetes is a challenging condition that affects young and older people, but with proper care, frequent monitoring, and simple lifestyle changes, you can lead a pleasant life with the condition. Common symptoms. The symptoms of diabetes can manifest in various ways, including increased urination, dehydration and thirst, increased appetite, blurry vision, unexplained fatigue, numbness or tingling in the hands and feet, wounds that take longer to heal, Unexpected weight loss. Thrush. Hyperglycemia is when blood glucose levels are too high. Patients with hyperglycemia exhibit dry mouth, nausea, vomiting, a fruity smell on the breath, difficulty breathing, and coma. Untreated hyperglycemia can be life-threatening. Hypoglycemia is a potentially life-threatening condition of having extremely low blood glucose levels. Symptoms include shakiness, a pale face, sweating, chills, anxiety, and rapid heartbeat. Other hypoglycemic symptoms include dizziness, lightheadedness, nausea, weakness, extreme fatigue, tingling, and severe headaches. If untreated, patients can develop seizures, loss of consciousness, or coma. The symptoms of hypoglycemia and hyperglycemia occur more commonly in type 1 diabetes than type 2 diabetes, and they are more severe in type 1 diabetes. Can type 2 diabetes change into type 1 diabetes? Well, the simple answer is no. Even though the two main types of diabetes share similarities, they aren't caused by the same factors. Patients who suffer from an uncommon condition called latent autoimmune diabetes in adulthood, LADA, can be thought to have type 2 diabetes when they actually have type 1 diabetes. LADA mimics type 2 diabetes, but the fact that it is an autoimmune condition which prevents pancreatic cells from producing insulin makes it a type 1 diabetes disorder. The LADA test establishes the diagnosis. So, to clarify again, type 2 diabetes cannot become type 1 diabetes. Final thoughts. Whichever type of diabetes you suffer from, you should adopt a healthier lifestyle to support your treatment. Insulin-dependent individuals can't simply throw out their injections. Instead, they should use lifestyle changes to improve their overall health while adequately treating their type 1 diabetes. Type 1 diabetes is undoubtedly stressful, but amazing advancements are being made that could change the way we treat it in the near future. Don't give up hope, even if you have to rely on insulin.